As a headache specialist, it's very satisfying to see improvements when patients undergo some of these interventional procedures, and that brings relief in their pains. We have Dr. Suma here with me.
Hi, I'm Dr. Suma. I'm from Bangalore. I'm having chronic migraine. So I came and met sir with chronic headache for more than 1 year, especially it's chronic migraine. One of my neurologists has suggested they have tried all the possible medication which didn't help. So I lost all the hope and I came and met sir. He gave me such a good hope that everything can be taken care of, and I went with whatever sir has suggested, the neuromodulation technique, and I have taken these injections once in a week for 4 weeks. Today is my 4th week. From almost 3 weeks I'm pain free and I'm able to go for my work and I'm back to my normal routine.
So, what happens in a comprehensive headache and facial pain center is that the patient comes in, we do a detailed assessment. After the assessment, which can go on for about half an hour to 45 minutes to even up to 1 hour, depending on the condition, then we make a plan, and this plan is executed with the assistance of the headache nurse and other therapists who are with us, and then these interventional procedures are administered in the outpatient clinic. It takes about 10 to 15 minutes for the procedures, after which the patient goes back home in about 10 minutes. So it is as convenient as it is, and it doesn't require any hospitalization, and it's a relatively painless procedure as well, and it takes only a short duration of time. Dr. Suma, a lot of patients have a lot of apprehensions and fears when it comes to injections, interventions. So I just wanted to, from a perspective of a patient, what is your experience and what did you actually have to go through?
It's a very minor procedure and takes for just hardly 5 to 10 minutes of time, and the needles used are very tiny, and it's almost pain-free procedure and very convenient, because it just hardly takes 5-10 minutes to take the injection and 5-10 minutes to monitor, and I can go back to my work after the procedure.
The anatomy of the nerves is very important, and it has to be focused and directed after deciding on which are the nerves which are most diseased or hyperactive, and that differs from patient to patient. So there's no one single protocol that is followed. It is tailor made depending on the patient situation and the patient's condition along with the disease. So it's not something which is defined as to the number of injections and the locations of the injections. But generally speaking, multiple areas are targeted. You can compare it to a surgical strike. For instance, in warfare, they give precision, targeted sort of attacks to the enemy region rather than give a carpet bombing. A carpet bombing is generally when we take something which affects the entire system. For example, even medications. It goes through the entire system and affects many nerves which may be normal, which is why a lot of people experience side effects such as drowsiness, weight gain, etc. But when we give a targeted therapy, we are only focusing on the diseased region, and that is what is a neuromodulation for headaches.
Thank you, sir, and thank you, Narayana Health Unit.